Question number 19. 72-year-old man ultrasound shows uniformly hypertrophic lesion that is enlarging and almost replacing all of the non-parenchyma of the right testes, enlargement of the right epididymis and adjacent spermatic cord. Left testis is 2.5 centimeter hypochoric lesion with normal spermatic and cord epididymitis. Diagnosis: lymphoma. How is it? Because it is greater than 60 years old. Age patient is bilateral testes and infiltrated testes. No aggressive feeder, so lymphoma. Question 20. Female diabetic cystoscopy to number of yellowish raised lesions in the bladder. IV with multiple small filling defects in the distal left ureter and bladder which are 3 to 8 mm in size, diagnosed by leukoplakia. Seen a diabetic patient and same cystoscopy shows yellow raised lesions in the bladder. The IV with multiple small filling defects in the distal left ureter and bladder, diagnosis by leukoplakia. Question 21. Epigastric pain, elevated serum amylase and calcium, CT is equal to peripancreatic inflammatory straining, renal memory nephrocancination, and circulatory joint erosions. What investigator would you recommend? Serum parathyroid hormone assay and technetium-99 and system scan. Diagnosis: pancreatitis due to hyperparathyroidism. Epigastric pain, elevated serum amylase and circulum shows pancreatitis. Then CT shows peripancreatic inflammatory straining, so pancreatitis. And then this renal memory nephrocancination and circulatory joint erosion, this shows hyperparathyroidism. What do you do next? Serum parathyroid hormone assay and technetium-99 system scan, because diagnosis is pancreatitis due to hyperparathyroidism. To see the parathyroid gland. Question number 22. Woman PRCA positive breast cancer surveillance lesion within the left breast, which MIP is most predicted for malignancy, irregular margin. Breast malignancy is irregular margin. Also malignancy is spiculators. Question 23. Ultrasound shows large epididymal cyst in addition to an abnormal area within the posterior lateral aspect of the right testis, rounded in shape on transverse scanning but elongated on longitudinal scanning. Epididymal cyst and withered in an abnormal area within the posterior lateral aspect of the right testis. It is rounded in shape on transverse scanning but elongated on longitudinal scanning. It is hypochoric with multiple small cystic spaces in sponge-like consistency. So sponge-like consistency, no concurrent Doppler imaging most likely causes tubular ectasia of the right testes. The sponge-like consistency and along with epididymal cyst another abnormal area, diagnosed tubular ectasia of the right testes. Question 24. Diabetic patient with poorly controlled hypertension or ultrasound is equal to small left kidney, which measures 5 cm in bipolar diameter. Right kidney is also small, measuring 6 cm. The resistive index is measured 0.9 on both sides. The peak systolic velocity is 130 cm on left and 150 on right. With interventional treatment, no interventional treatment, because these are already small kidneys, and patient is already having diabetes with poorly controlled hypertension, small kidneys, so it all will show poor outcome, all these features. So no intervention. Question 25. 2.23-year-old dyspareunia patient has dyspareunia and pelvic pain. 6 mm rounded area of high signal intensity on T1 and high T2 signals in the left posterior lateral aspect of distal vagina, most likely diagnosed Bartholomew Glances. Pelvic pain. 6 mm rounded area of high signal on T1 and T2 in left posterior lateral aspect of distal vagina, diagnosed Bartholomew Glances. Question number 26. Ultrasound of thyroid shows solitary hypochoric nodule with punctured calcification and increased vascularity. Finding explanation shows benign etiology. What to do next? Repeat finding explanation because malignant feature. Ultrasound of thyroid shows solitary hypochoric nodule with punctured calcification and increased vascularity. These are all malignant features. Solitary nodule, punctured calcification, increased vascularity, and the thyroid gland is malignant feature. So finding explanation was benign, but what to do next again? To repeat FNA because it shows malignant features. Number 27. Which statement regarding breast screening in UK is correct? 2 lives are saved for every overdiagnosed case. 28. Additional lobule separate from the main polyp of placenta. What is the variant of placental morphology known as succinturite placenta? Question 29. You are the interventional radiology fellow in your hospital. The nephrologist asked you for an opinion on 4 patients they feel require renal arterial intervention. Patient A is a 68-year-old man who is in a catheter angiogram which shows 60% narrowing right renal artery. The patient has refractory hypertension. Patient B has 48-year-old female with refractory hypertension. She also had MR angiogram which shows number of stenosis with intervening mild aneurysm formation in the proximal right renal artery, and then formation in the right proximal right renal artery. And patient C is a 72-year-old female with impaired renal function who underwent capital renal scintigraphy. On the baseline study, there was similar appearance of the kidneys. On the capital study, there was differential split of renal function of 15% between the right and left kidney with decrease of time to peak acuity of 20 seconds. The final patient D had a gradient Doppler ultrasound which showed biphasic flow pattern in the segmental artery with a slow upstroke. Which of these patients has significant atherosclerotic renal artery stenosis? Patients C and D have. Because, question number 29. A 70% stenosis is taken as a cutoff for significant stenosis. Patient B is atypical in their age. They also have imaging characteristics typical for muscular dysplasia. Patients C and D have causing imminent fear of renal artery stenosis. With regard to ultrasound diagnosis, in Doppler, this made by either showing flow acceleration immediately to the site of stenosis or showing time flow in the segmental arteries. In the renal artery, a peak systolic velocity of over 180 centimeters per second combined with renal arteries. Renal aortic velocity ratio of 3 is reported as being more centimeter for renal artery stenosis. Okay, so intervention will be doing of C and D because they have renal artery stenosis. And C, what do we see? A 70-year-old female with impaired renal function who underwent capital renal sonography, and then based on the different split of renal function of 15% between right and left kidney, decrease of time peak activity of 320 seconds. So this shows renal artery stenosis, and D renal Doppler ultrasound which show biphasic flow pattern in the segmental arteries with a slow upstroke with a TARDIS spiral pattern. And patient C, peak velocity of over 180 centimeters per second. So this patient has time to be active of 320 seconds. So, and patient A and B, patient A has 60% narrow Asian artery stenosis, so you need at least 70%. And patient B has muscular dysplasia, number of stenosis. So for this we'll do angioplasty, not intervention. Correct? We do for B we do not do renal artery intervention. We do angioplasty for muscular dysplasia. Number 31. Thyroid carcinoma, which is useful in assessing recurrent calcitonin. 32. 24-year-old woman with palpable left side breast lesion, mobile 2 cm lesion. Patient has a phobia of needles. Next step in management: reassure and discharge with advice. Because 24-year-old patient and fibroadenoma, so we do not do biopsy. It's benign lesion and 24-year-old, so we reassure and discharge with advice. Question 33. Permanent corneal Burton. Which phase of CT renal tract examination would be best for this variant? Cortical medullary phase. Permanent corneal Burton will be best seen in cortical medullary phase. Question 34. Blind right side renal biopsy. Diagnosed glomerulonephritis, hematuria, IPU on 15 and 20 minutes images. Pen the program, which would be likely to be controlled diagnosis. Arterial phase CT up down. This diagnosis adrenal vein thrombosis. So arterial phase CT up down will not help us. And here, patient has a biopsy and then IVU on the 15 and 20 minutes images. There's pain in the program. So most likely he has lesion in the vein, renal vein thrombosis. What would this like controlled diagnosis? Arterial phase CT would not help us with problem is in the renal vein. Okay, question number 35. CT shows lung carcinoma, enlargement of the right adrenal gland. Which one sequence is of most useful and further characterizing the adrenal abnormalities? The in and out of phase T1, because signal dropout on these in and out of phase will show fat lesion. And patient has enlargement of right adrenal gland, so if we see fat lesion, there will most likely be benign angiomyolipoma.